Smoothing out wrinkles are today's non-surgical option for facial contouring and sculpting.
You doing all right?
Yep.
Good. Any pain?
No.
Great.
Facial plastic surgeon Dr. Etai Funk is seeing more and more patients who choose a needle over a knife to help them look younger. So if you're going to have your face contoured, where can you actually have it contoured?
Sure. Well, volumetric contouring can occur pretty much anywhere on the face, but places that I like to isolate are the brow, to elevate the brow just a bit through here and provide that nice aesthetic peak. The temple region is where we lose a lot of volume as well, and that's an excellent place to provide deep filler.
Fillers can also be injected in the cheekbones, jowls, and nose. However, if sculpting the nose, Dr. Funk warns.
These are for patients who do not want surgery in the future because this will cause some scarring underneath the skin, which will make future surgery extremely difficult.
Meet Linda and Suzanne. Both want their faces to reflect the vibrancy they feel. At 64, Linda wants to grow old gracefully, but feels insecure about her appearance.
I was concerned about this area here. I had deep wrinkles. I had my granddaughter ask me, Mimi, why do you have those wrinkles there? I said, because I'm old.
And even if she thinks she's old, that doesn't mean she wants a facelift. Instead, she meets with Dr. Funk for an alternative.
What frequently happens as we age is that this fat pad that sits right here starts to descend. And so we have this look of deflation with a prominent fold that runs through here and prominent folds that come down through here at the corner of the lips.
Dr. Funk uses deep injections of Radiesse in her cheeks and also her jaw to remove the jowling and square masculine appearance of her face.
This substance lasts a little longer than the hyaluronic acid fillers, and it promotes a collagen response. So after the filler has dissipated or is gone, we have a replenishment of collagen in the body in that region.
Next, he injects Juvederm superficially around the corners of her mouth, as well as Botox for her crow's feet.
That's great, looking great.
Just 2 days after her contouring, Linda meets her good friend for lunch.
And we're sitting there talking. All of a sudden she goes, I don't know what you're doing to your face, but you look great. I said, I went to Dr. Funk. She said, I said, I can't believe it. You just look wonderful.
Not only does Linda look wonderful, in no time she feels wonderful. Botox lasts 3 to 4 months. Juvederm lasts 9 to 12 months. And Radiesse lasts over a year. So for Linda, maintenance is required if she wants to keep this fountain of youth. Will she continue contouring?
It's easy. I mean, and I like the results. So why not?
At 56 years old, Suzanne is also ready for a refresher. She asks Dr. Funk to help her turn back the hands of time.
We saw that this fat pad, this malar fat pad, had descended and left a distinct line here between this orbital zygomatic fat pad and this fat pad through here. And this is a common area to fill with a deep filler like Radiesse.
Dr. Funk also injects Radiesse in her jawline. Since Suzanne has more jowling on the right side, Dr. Funk injects the filler in the front of the bone to give her face a more heart-shaped appearance.
I feel like I look 10 years younger. If I'm walking in a department store and I see myself in the mirror, I don't kind of go, God, I look terrible. You know, I think I look good.
Plus, for Suzanne, this is also an economical way to look wonderful.
It's a big difference in money. I mean, the fillers I can do for, you know, a few $100s, and a facelift is many thousands.
Sometimes a face and neck lift may run anywhere between $8,000 to $20,000. Using volumetric filling may cost anywhere from $1,000 to $3,000.
For both Linda and Suzanne, their contouring experience is priceless. For more information on how to boost your beauty through sculpting, go to livewellhd.com.
It's a few